So let me step back and say, what is this faculty all about? And I am drawing here from our strategic plan of 2013 to 2018, and I want to remind you of our vision to advance health and equality in South Africa and beyond. And then in terms of our mission, the first bit has to do with education. So we want to promote a culture of transformative learning that really changes people. And the second is about research, contributing to the discovery, sharing, and translation of knowledge geared towards health and development. And then the third is to develop the broader community. And so we want to produce students and agents of change that can go out and be active citizens when they leave this institution. Now, you will have noticed that in the vision, we talk about equality, and I want to focus this talk a little bit on equality and inequality to try and explain why this interest in equality. So, if you've been reading the newspapers, listening to the radio, watching television in the last year or so, you have seen that everybody is talking about inequality. And Barack Obama here says this is the defining challenge of our era. However, the Pope has also weighed in on this. Christine Lagarde, from the head of the IMF, has spoken out very forcibly on inequality, and so has Jim Kim, the head of the World Bank. So everybody is talking about this. And the reason why this is, inequality has always been with us and will always be with us. The reason that there is so much focus on inequality now is the following: that the level of inequality, income inequality, is now so big that it actually is generally regarded as a very bad thing for our world. So here's the Oxfam report, at the beginning of the year, which came out and said that the bottom half of the world, if you add up all that wealth, 85 people now own the same amount of wealth as half of the world. And those people can fit into this bus. So that is the extent of the inequality. So we're talking about serious inequality in the world today. So that's at a global level. This also shows you the map of inequality across the world, and you'll see that we live in the part of the world which has some of the greatest or highest inequalities. And that's a bad thing for us. So not just South Africa, but the surrounding regions, extremely high levels of inequality. Then this graph appeared when Nelson Mandela died. This appeared in The Economist, which shows you the, let me see if I can get this. So these are the four traditional race groups, so-called, in South Africa. And you can see that since 1994, income has increased for all of the groups. So this is Black African at the bottom, colored, Indian, and white. But what you can also see is that the increase for whites and Indians has been sharply more defined than for the other two groups. And in fact, depressingly, the level of inequality, the gap between these two at the bottom and the two at the top, has actually increased since democracy. So I think that's important to keep in mind when you're thinking about, people often say, well, now that, we have democracy and apartheid is over, the playing fields are level. So we can just go on as if, this is just a normal society. Unfortunately, that's not true. And so we have to factor that into our thinking all the time. So let me say a few words about why this is important. There are three books that I've read in the last year. The Price of Inequality by Joseph Stiglitz. This is an American economist, a Nobel Prize-winning economist, who writes about how today's divided society endangers our future. Then there's this book, The Spirit Level, by two British epidemiologists, and they write about why greater equality makes society stronger. And then finally, the book that I'm struggling with at the moment is Thomas Piketty's Capital. And so these books are really quite important in terms of understanding not only where this sort of level of inequality comes from, but how it works and what effects it has on society. I'm summarizing some of the issues that come out of these documents and others. Here's how extreme wealth and inequality hurt us all. Firstly, it is politically corrosive. So that means it undermines democracy. So Joseph Stiglitz talks about one person, one vote has become $1, one vote. So you buy those votes, and you know the laws and the policies of kind of various countries. I'm not just talking about this one, but I'm talking about countries in general. Those laws are rigged in favor of the super wealthy, increasingly. It is also socially divisive. Meaning that with income inequality comes inequality in opportunity. So if you're more wealthy, you have a lot more opportunities, and that difference is so big now that it disturbs the cohesion in society. So the rich actually live in separate areas. They don't have to see the poor, and the poor operate, and they have become increasingly angry and so on. And so you have the division in society. It's damaging to health and well-being. It's environmentally destructive. The super wealthy are actually at the forefront of destroying the environment. It is economically inefficient. So the economists are telling us that in societies where there's big inequalities, the economic growth is much slower. And so that's actually a bad thing. And then it is unethical. So those are some of the arguments against this level of inequality that we're seeing today. So this is just a graph which summarizes some of the things in the Wilkinson and Pickett book, showing you on the x-axis income inequalities by the various countries and their levels of inequality. And then on the vertical axis, you have various indices of health and well-being, ranging from life expectancy through to drug and alcohol addiction, social mobility, and so on. And what you can see is that there's a very strong correlation between the prevalence of these problems and the level of inequality in a country. And they do this analysis in many different ways, and it's pretty robust. And so it's a relief that in our National Development Plan, they recognize that we have 3 challenges in South Africa. 1 is poverty, 2 is inequality, which is a separate problem to poverty, and the 3rd is unemployment. And these are the challenges that we will have to overcome if we are going to realize the vision 2030 as set out in the National Development Plan. So that is a little bit about income and wealth inequality. Of course, wealth inequalities are often more extreme than income inequalities. It's important to keep that in mind. A few words about inequalities in health and health care. So an important measure of how well a society does in terms of health and health care is the infant mortality rate. Right? And what you see here is that the greatest burden of infant mortality would be in Africa and Asia. Okay, there's virtually no problem in many of the other countries. But if you then look at public health spending, you see the opposite. You see that a lot of money is being spent in public healthcare services in countries that don't really have a big problem. So it's really the mirror, it's the opposite. And I think that's a sort of an inverse care law that we often talk about. And I think that, to some extent, also exists in South Africa. And I think we need to understand how that works. This is just another slide showing you child death, okay? Under 5 mortality and infant mortality. And shows you, if you're in the richest quintile, then you don't really have a problem here with child mortality. But if you're in the poorest group, you have a big problem, even in South Africa. So across South Africa, the problems are much bigger. Health problems are much bigger where there is poverty and inequality. Then I want to focus lastly on inequalities in research productivity, which is really the main focus of this talk, but I thought I'd just give you a bit of an overview of the other issues. So this map here shows you the Africa's output of publications in the Thomson Reuters Web of Science. And in this period, 1999 to 2008, Africa produced 27,000 articles per year. So that's the total production. Now, that's across all fields. Now, if you think that's a lot, then think again, because that is about the same level of output as one country in Europe, a small country like the Netherlands, produces about the same as the whole of Africa. Okay, so we are really, really lagging in terms of our output. Then things are not equal in Africa. So you'll see that South Africa is the only country in Africa that produces more than 7,000 articles per year. Okay? The other countries there that come into the picture would be Tunisia, Egypt, Nigeria, and Kenya. But as for the rest, there's not much activity happening. So Willem Gevers, in commenting on this picture as part of a review that we did together, he says South Africa occupies a paradoxical position in the context of scientific publication. It is simultaneously a giant within the African context and a dwarf in the international arena. I wanted to show you just a comparison between all of South Africa's research institutions compared with one institution in Brazil, University of Sao Paulo. So you will see that the number of students we have is about 900,000 compared to 90,000 in that one university. But the number of publications, Brazil, 9,000, and that's more than we produce in that here. PhD outputs, look at this. Okay, they almost produce twice the number that we produce. And then the last one is percent academics with PhDs. Almost all Brazilian academics have PhDs compared with only a third of ours. So I'm just stressing that we have a lot of work to do. If you then look at research productivity across the South African landscape, across the 23 universities in South Africa, you'll see that things are not equal. That Stellenbosch is doing very well at the moment in terms of weighted output of research per capita at around 3, but you could cluster the universities into those 3 categories there, where we're in the sort of cluster A and doing well. But if you look at the ones at the lower end of the spectrum, the figure there is 0.09 versus 3 in terms of units per capita. Those institutions there are sometimes referred to as the Big Five, and you can see that they do occupy the top end of the spectrum. And of course, the one that I haven't put a block around is Rhodes University, who usually does very well in terms of research as well. So now I want to show you other levels of inequality within this research production. And I'm drawing here from the ASAF report on revitalizing clinical research. So what you can see is the 2 5-year periods, and this is the percentage of articles from people that were female. So you'll see that female authors just roughly over a third, 35% in the first period, and rising to only about 38%, so somewhat lagging behind men. What about our faculty? So this is data from CREST, and what the data shows, this is a different period, 2006 to 2011, but you can see it's around about 38% female here, and then pretty flat after that. So nothing is really getting better except for the 2011, which has a bit of a blip there. And we don't know which way. That's an encouraging blip, but we don't know if that's sustainable. But you can see that there's quite a difference between the output from men and women. What about the research output by race? And you can see here that in the two periods, it went from 14.9% to 18.4%. So, you know, across the country, a country which is predominantly black, producing only 15% or so of the articles from that group. This is our faculty. You can see that from 2006 to 2011, it's even lower. It's 13% up to 18%. So lots of work needs to be done in correcting that imbalance. And then this is by age group. And what this shows you is, if you look at the yellow bits at the bottom, that represents people under 30, and the trend is in the wrong direction, okay, from 6 down to 1. Similarly for the next age group, from 33 down to 17. So younger people producing fewer of the publications, and the older people went from 2 to 15. Those are people over the age of 60. So the typical sort of aging cohort that we talk about. Okay, so that's a problem. You know, if younger people are producing fewer research articles, then we have a problem sustaining our enterprise going forward. This is medicine and health sciences, and unfortunately now the age order is in the reverse, but if you could just stick with me, the bottom one now is 60 plus, and you can see it's the same trend in our faculty. 2006, 11%, up to 2011, which is 20%. And similarly, the younger group, again, producing fewer articles. Again, this national trend is also being seen in our faculty, and it needs to be confronted. And then this just shows you by research output by the type of research from the ASAF report. You can see that for public health research, things are pretty flat, as well as for basic science research, but for clinical research it's actually dropping. And you know, that should sound alarm bells, that in terms of our clinical research output, we're actually not doing as well as we used to do. So that is across the country. So these are some of the inequalities that I just wanted to highlight for you. And my argument is that I believe that diversifying the research workforce is very important, and it will help us address the current health and healthcare inequalities in this country. And I'm asking, are we doing enough to address this challenge? So I'm not going to talk to these next two slides in detail, but I just wanted to show you that there has been an ASAF process. They've made various recommendations in terms of strengthening or revitalizing clinical research. And the good news is that many of these recommendations have actually been implemented, which is quite unusual for these reports as they go. But you know, the National Department of Health, the MRC, the NRF have already come in, and the DST have come to the party, and they've actually started introducing, as you can see from this list, a number of these interventions. And that's good news, and I think we should celebrate that, because that will improve research output in South Africa. This is just a further list. Some of these are work in progress. We have seen significant increases in funding through the MRC and other mechanisms, and that's exciting and very important. But I think we need to, if we're going to get up there with the Brazils of this world and other similar countries, we're going to have to improve our commitment to funding in research in this country. The question that I have been reflecting on a little bit is, if we simply increase the funding for all research and we promote research just generally, will that help to address the disparities in terms of gender, race, age, etc.? John F. Kennedy said, "A rising tide lifts all the boats," and is it true of research? And I think that it may be true of boats, but it may not be true of other things. So it's a parallel would be trickle-down economics. People used to argue that if you give more money to the rich, it will kind of trickle down to everybody else. Now even the economists are saying that's nonsense. It doesn't happen. Okay, and I fear that unless we have targeted interventions to address these disparities, we're also not going to see much of an improvement in this country. So before I close, let me just show you, oops, it's really going faster, the researcher development pipeline. So what we really are after is we want to make sure that we have enough people from the underrepresented group going through that pipeline and coming out as independent researchers. And I've added mentor leaders. And I'll say a bit more about mentoring, but I really think that there is a role for not just being an independent, principal investigator, but actually taking responsibility for developing the future cadre of researchers. I think there are three areas that we need to concentrate on. One is we need to attract more people into the pipeline. So, we have a big problem with high school education, we all know that. Our university is engaging in trying to improve maths and science education in the schools. I think we need, as a faculty, need to be thinking, what role can we play? We need to raise the awareness of careers in science. People just aren't, if you're never exposed to anybody in your family that's gone into a science career, why should you think of going into that field? We need early exposure to doing research, not only at high school, but also at the university undergraduate level. So we're very excited about what's happening in our faculty in terms of undergraduate research. We need more of that. We need to talk about intercalated degree programs, PhDs or masters while doing other studies. And so just to expose people to doing research. And then mentoring. Then the second area is, once you're in the pipeline, we need a total commitment to developing people. So we need to think of people's skills, and skills are very general, so I'm not going to go into all the skills that you need, but certainly research skills would be one of them. We need protected time for people who are clinically active, clinically involved. They are, working in the hospital. They need time out, and so, what do we do about that? And then we need funding. So we do have some career development awards in this country, but I don't think it's anywhere near enough. I think, if you look at what the US, the UK are doing, there are tons of opportunities for career development awards, and I think we need to improve that. And then I've added mentoring again. The reason I've put mentoring in each of these blocks. Then finally, we need to prevent leakage out of this pipe. There's quite a lot of leakage out of the pipe, and I think that there are often many other issues peripheral to actual research, economic issues, people with financial problems, family responsibilities, particularly often it's women that's affected by that. Career opportunities that are not created, which means people bolt and go elsewhere. And then I think we need to also make sure that we mentor people as well. So about mentorship, I think mentorship is something we don't talk about enough. And I've looked at some of the literature around mentorship recently, and I was really quite excited about some of the things that are going on. And here's just a quote that I wanted to leave with you from this paper. It says, mentors are people who can see more in you than you can see in yourself. They create a vision and a development plan that take advantage of your own strengths, abilities, and potential for growth. Effective mentors are so unshakably convinced that we have greatness in us, and their vision of what is possible is so clear and powerful that they wind up convincing us too. And if you're a successful researcher, I'm sure that you can think back of people that you met along the way that did this kind of thing to you, that really lifted you up and made you feel that everything was possible. And I think we need to have that mindset when we deal with younger researchers, with women, all the underrepresented groups that we have. So what do we know about mentoring in the health sciences? There have been recent systematic reviews that have looked at this comprehensively. What we know are the following. One is the prevalence of mentoring varies widely across various fields. Some fields do it much better and others not. Mentoring has an important influence on our career choice, the career progression, faculty retention, and productivity, which includes publication and grants. We also know from the systematic reviews that individuals from underrepresented groups, some of them I've mentioned, have more difficulty finding mentors. Then we also know that there are many different mentoring models. And we need to understand those models a bit more. It can vary all the way from informal relationships to more formal systematic arrangements between two people. And then, what does it involve? Usually, it comprises a combination of emotional, psychological support, guidance on career and professional development, and so forth. So it's not necessarily showing people how to use a pipette. It's much more it's the softer things very often that helps you, see things differently in the world. And that's what a mentor really contributes to your development. Then, of course, the systematic reviews also show that there are many unanswered questions. There are many questions that we would need further research about, but I won't go into those at the moment. The implications of all this is that I believe that as a faculty, we need to encourage mentoring more. We need to do it at all levels, not just in academia and in the academic group, but also in the support services and throughout the full spectrum of what we do. Does it need to be included in your work agreement that you commit to mentoring somebody? That's something to think about. Sometimes people just don't know how to mentor, and so I think there's scope for training in mentorship. Then we need to think about how do we fund this. Okay, this sometimes requires time out of what you're doing. So can we support people through funding mechanisms that promote mentorship? And then very importantly, we need to evaluate what we do. We need to evaluate the process, and we need to evaluate the outcomes of our mentoring. And all of that, I think, are things that I certainly am thinking about, and I'm sure many of you are as well. And I think we need to come together and discuss how we can do this better. So my final slide is this. I've reminded you that in our vision of the faculty, we state that we're committed to improving health and equality, and we need to take that seriously. I've also said that inequalities in research productivity are undesirable and should be systematically addressed, and that this will require a pipeline approach which involves attracting, developing, and retaining people from underrepresented groups. And then lastly, I think we can't do this by ourselves. We need a partnership. We need to work with other institutions. We need to work with the private sector. We need to work with the parastatals, the funders. All of these people have to come together in order for us to be able to do this more effectively.